Video number 3, pocket dissection, implant removal, and partial capsulectomy. We usually use two types of electrocautery, one with a straight tip for initial dissection, and the other with a curved tip, rigid, which allows lateral and medial dissection of the capsule adhesions close to the EMF. It is important for the assistant to perform a constant traction to expose the dissection plane. In secondary cases and with the implant in the subglandular pocket, we perform a complete dissection of the posterior region of the implant, releasing the pectoralis major muscle, as you can see here, on the lateral and posterior aspect of the capsule. Here in this view, we have almost 90% of the back of the capsule released. At this point, we open the capsule and expose the implant. With the rigid curved cautery, we opened the capsule in the medial and lateral regions, releasing the entire implant. It's a round and macrotexture surface implant, as you can note here. With the removal of the implant, we then performed the posterior capsulectomy through traction of the segments of the capsule and section with the curved cautery. It is important to maintain a constant traction and also to have a very rigid cautery in order to cut adequately the segments of the capsule. Here is the lateral aspect of the capsule, very close to the inframammary fold. Here is the section point of the posterior capsule and remove it completely. Small bleeding points are identified and hemostasis is then performed under direct vision.